Jonny. I'm one of the physios at Physio Rooms. Talking to you about tennis elbow pain. It's quite a common condition that we see in here, and we've started to see quite a lot of it recently because of obviously people trying to get fit and healthy for the holidays that they've got coming up. So as a result, a lot of people are going back into the gym, but they're not necessarily going back gradually. So tennis elbow is like an overuse injury. Most often people have pain just on the outside of the elbow around here. And then that will cause like a dull ache quite often. It'll tend to be exacerbated by any activity involving gripping. One of the things would be if you have any of these symptoms, do come in for a full physiotherapy assessment. That would be the best thing to do because we can identify if it is in fact tennis elbow or if there's something else going on that might need slightly different treatment. So activities, these tendons attach at the elbow here. Every time you're gripping, you're also extending your wrist up like that, which tends to put pressure here. Now, the common issue that people have with this is a lot of the time it lingers. They don't link the overuse to actually the injury as well, so a lot of people don't go gradually into the activity. It's very, very important with any activity that you gradually phase yourself into it. Tendons, if they don't have the capacity at the time, are more likely to degenerate, are more likely to become an issue, and as a result they're more likely to cause pain, which is a lot of what we see in here at Physio Rooms. We understand the frustration. You want to get back, you want to get healthy, you want to get fit, but what you also don't want to do is put yourself out for months and have it influence your life in other areas as well. So if you're getting pain on the outside of your elbow, come in for an assessment. We'll speak to you, we'll give you our guidance on what is best going forward to limit the chance of this affecting your quality of life.